The madness continues, doesn't it? This is Christmas Revisited, and the rules seem to be changing by the hour. As at 8:30 this morning, there were no serious coronavirus cases in Australia. None. But there are 76 in Queensland and all up 78 in Australia. So what do? 909 deaths, when the road toll last year was 1,190. 909 deaths from coronavirus in 14 months, but 3,571 people suicided last year, many, I'm sure, because of these appalling restrictions. Suicide, 4 times the number of COVID deaths. The influenza total last year, 4,363, 5 times the COVID deaths. The latest defies belief. Queensland Health and whoever runs Princess Alexandra Hospital allowed doctors to work in close proximity to patients who had tested positive when the doctors hadn't been vaccinated. That's pretty smart, isn't it? All started on March 9. An unvaccinated doctor was caring for a COVID patient at the Princess Alexandra Hospital. An unvaccinated nurse caught the virus on March 23, and she infected her sister, their friends, and a male entertainer at a Byron Bay hens party last weekend. A tradie picking up a few extra bob at night as the entertainer. He tested positive, but he'd been working at a Mermaid Beach cafe, so they named the cafe. That finishes that poor bloody cafe owner. It's madness. This is unbelievable. How on earth could Brisbane's second largest teaching hospital and the bosses at Queensland Health not ensure that doctors and nurses treating coronavirus patients were vaccinated? But a doctor and a nurse from Princess Alexandra Hospital were unvaccinated, and here we are tonight. No, hang on. Canberra's to blame, says the Health Minister, Yvette Dath, because the state couldn't administer vaccines it didn't have. That is a complete untruth. Queensland has used barely half the vaccines they've received, and you're telling me we've got to close the whole joint down because apparently we don't have the instruments to cover a small cohort of medical staff. This is where it began, Princess Alexandra Hospital. So Brisbane people are locked in their homes and maybe over Easter. Politicians love this alarmism and they love the control. Businesses are going under. Thousands of holidaymakers have cancelled, and the public have had 15 months of this crap, this disproportionate response. Alarmism and fear reign again. And you've got the Chief Health Officer, Jeanette Young, not ruling out, by the way, that the lockdown could extend to places like Gladstone, the Gold Coast and Hervey Bay. 75 flights into Brisbane were cancelled yesterday. In Ipswich, which is inside the lockdown zone, more than 120 cancellations in 24 hours. I mean, this stuff is sickening. I repeat, these cases have not been reported as serious, not one, across Australia. It's pretty rough though, isn't it? When the Queensland Health Minister, Yvette Dath, tells lies that the state had been holding back quantities of the Pfizer vaccine for second doses, the Commonwealth has repeatedly said no state needs to do that. Dath's words on Monday. This is absolute.
We have to hold back enough Pfizer to give them their second vaccination because we can't be sure, and even the Commonwealth can't be sure when that Pfizer delivery is going to come to Australia and also when it's going to get out to the individual states.
Well, Yvette Dath, you won't talk to people like us. If you did, I'd tell you were telling lies. This is absolute rubbish. So on Tuesday, she changed to tack. And she said, we'll use all the vaccines that are given to us, which of course she isn't. Queensland have received 106,000 vaccine doses and administered only 65,000. I repeat, the Federal Chief Medical Officer, Paul Kelly, reiterated yesterday that state governments should not be stockpiling vaccines to account for second doses. One problem is there are still dopes in government and the bureaucracy who believe they can eliminate the virus. They can't. We're going to have to learn to live with it and manage it, which plainly is beyond the competence of most politicians. I repeat, there are no serious cases of this virus in Australia at the moment, but now we're told Byron, Ballina, Tweed and Lismore Shires are being thrown into the mix. People there are being urged not to leave their local area, so they'll be locked up like battery hens. How on earth can business manage in this environment? How can families and children? This is not the way to manage the issue. Even the World Health Organization says lockdowns should be the very last option. And the safest place to be is in the open air, in the sun. Now, it's all very well Premier Palaszczuk saying, fingers crossed, all will be looking good for Easter. This lockdown has turned Brisbane into a morgue. Businesses are on their knees, if not out the door, and people young and old are being told, sorry, no job. Let's go to Peter Gleeson, whom you can hear on Sky News every Monday to Thursday night at 11 o'clock, but he knows Brisbane backwards. Gleeso, great to talk to you. It's a bit after 8 p.m. now, Wednesday night. Good Friday, the day after tomorrow. How do you see things?
Well, we may have dodged a bullet, Alan. I mean, the figures today were very encouraging. But the question here is not whether or not we've dodged a bullet. The question is, how did this madness occur? And the state today, the Queensland government was very quick. Stephen Miles, the Health Minister, Anastasia Palaszczuk, Yvette Dath, to point the blame at Canberra, which is their stock standard tactic when it comes to this sort of thing. But the real question here is not about the vaccination rollout and the speed of it, but the prioritisation of the vaccination rollout. We've got pharmacists here who have had the jab. We've got wardsmen in some of those hospitals that have had the jab. And yet here we've got a situation where we've had doctors and nurses who are at the front line, those who are treating patients who actually do have COVID, not being vaccinated. It is madness. It is an absolute scandal. And the diversionary tactics that are being used in this state are absolutely scandalous. And I think, you know, Queenslanders tonight will be looking at the way in which this has been handled and thinking to themselves, how are we going to get through this?
What's your feedback from business, Peter? I mean, you think of the financial, the health, the psychological effect on families. I spoke to Professor James Allen last night about this alarmism and fear. I mean, if the damage is not spread equitably, lockdowns should not be contemplated. Now, it's not. These people making all these rules haven't lost a cent.
Businesses have had a gutful, Alan. They've had an absolute gutful. We've got a chief health officer. Why haven't we got a chief commercial officer? Someone who's looking after the mental health of our businesses. Correct. The tourism operators who are on their knees down on the Gold Coast, on the Sunshine Coast, the Whitsundays and Cairns. And every time there's a bit of light at the end of the tunnel, Alan, you know, when they think, well, we've sort of got this thing beat, we can plan with certainty. Confidence is the key. They want confidence, Alan. They're not getting confidence at the moment.
But the government, these people seem to be without shame. I mean, they keep their jobs, they keep their salaries, they keep their pensions, and they're devastating people's lives. And then when it all goes wrong at the Princess Alexandra Hospital, they tell lies. I mean, eh?
I think, Alan, we're at the stage in this country, and you so eloquently put it during your opener, where, you know, during times of war, we bequeath the big decisions to the Commonwealth. You know, this goes back to the Federation. What we have seen during this pandemic is states and territories at every opportunity, one eye on the ballot box, the other eye on how they will make sure that they keep the community safe. And keeping the community safe is important, but they've forgotten the fiscal and the economic narrative. Absolutely. And so what's happening? What's happening is people are, as you say, people are committing suicide. People are on the ropes when it comes to their business. And, they're wondering, what's next?
I know. Well, I've got a solution as how to manage the virus. I'll tell you, Peter, where the lockdown should be. Lock down all government, get them out of our lives and let us manage our own well-being. You have a great Easter, Peter Gleeson. Always great to talk to you.